It looks like we are live on Facebook. Hello and welcome back to Wellness Wednesday, where we share practical wellness tools and techniques from experts on topics that are important to patients, survivors, and caretakers alike. I'm Erin Kuhn-Krieger from Rolf Pancreatic Cancer Foundation, and I'll be co-moderating tonight's session, the Wellness Wednesday installment with Savina Chicheva and our partners over at Cancer Wellness Center. It's sure to be an informative conversation with tonight's panelists. We have an oncology advanced practice nurse and an oncology dietitian. For our friends joining us through Cancer Wellness Center, I wanted to tell you a little bit about Rolf Pancreatic Cancer Foundation. We are a local Chicago organization with connections to some of the leading pancreatic cancer hospitals and organizations in the Midwest and beyond. Rolf Foundation provides personal and tailored support to patients, survivors, and families in crisis by connecting individuals with medical experts, personalized resources, and education. We create awareness around risks and symptoms, and we fund early detection research. Our hands-on approach ensures that no one has to face this alone. So what does that look like? Well, we do this by directly connecting patients and families with medical experts and specialized resources. Rolf funds research because we know the best chance of saving lives is through early detection. And we provide ongoing education and support, like our panel tonight, to empower patients and families to make quick decisions with confidence. Rolf also prides itself on supporting and building community. And on that note, please save the date for this year's Dashing Together Virtually on Saturday, July 10th. Whether you want to run, walk, dance, bike, you name it, we'll once again gather together virtually to raise awareness and much needed dollars to support Rolf's mission. Stay tuned for details that are going to be coming up. You can learn more about Rolf Foundation at our website, rolffoundation.org, and connect with us through our social channels as well. We'll put links on all of those into the chat box so that you have the information and easy access. Now, a couple housekeeping items before we get started. Please ask questions throughout the session in the comment section below. We'll be saving questions to the end to make sure that we get to everybody. Now, please note, this presentation is intended to be a resource for educational and informational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment, and should not be interpreted as or relied upon for treatment recommendations. Nutritional and medication recommendations are based on individual patient circumstances and needs as determined by an appropriate, qualified healthcare professional according to his or her professional judgment and expertise. So please be sure to check with your medical team to see what's best for you. Now, I'm thrilled to introduce my co-moderator for tonight, Savina Chicheva from Cancer Wellness Center, who will introduce you tonight's speakers. Hi, Savina, it's all yours.
Thank you, Erin, and thank you, Rolf Pancreatic Cancer Foundation, for collaborating with the Cancer Wellness Center for this program. Good evening, everyone. Thank you for joining us today. For those of you new to the Cancer Wellness Center, I'd like to take a minute to tell you more about the work that we do. The Cancer Wellness Center is a nonprofit organization aimed to improve the physical and emotional well-being of those impacted by cancer and their families. We provide a variety of programs and services, which include education programs like the one this evening, wellness classes, things like yoga, tai chi, meditation, all that help provide a holistic approach to a healthy living, and support services, which include counseling and support groups that are designed to help patients, their loved ones, and those bereaved to manage the mental and emotional impact of cancer. If you'd like to learn more about the center and connect to our free programs and services, please visit cancerwellness.org. The link to both of our websites will be in the chat. Now, without further ado, I would like to introduce our two cancer experts this evening, Gayathri Moorthy and Lori Bumbaco. Gayathri Moorthy is a board-certified oncology nurse practitioner at the NorthShore University HealthSystem's Kellogg Cancer Center. She earned a bachelor's in biomedical science with honors from the University of Adelaide in Australia in 2003 and a PhD in molecular biology from Nanyang Technological University in Singapore in 2008. After some postdoctoral work at Rush University, Gayathri became interested in working with patients directly and therefore earned a nursing degree from Harper College. She worked as a registered nurse in radiation oncology for 6 years before earning a master's in science and nursing from Loyola. Besides collaborating with the care team to meet the needs of patients undergoing treatment of cancer, she is involved in cancer genomics effort at NorthShore. Quite an expert, lots of background. And then I'd like to introduce you to Lori Bumbaco. Lori joined the Cancer Wellness Center in 2015 and is a board certified specialist in oncology nutrition. In addition to doing individual nutrition counseling, Lori co-facilitates our Weight Loss for Wellness group and our Mindful Kitchen program. She also works part-time at the Kellogg Cancer Center and is a professional speaker for Lilly Oncology. Lori is also a co-founder of Cancer Nutrition Care Team. Lori's interests include empowering survivors with reputable information, building confidence in the kitchen, and exploring how food is more than just nutrition. Thank you both for being here today. Welcome, Lori.
Thank you so much, Sabina, and thank you all so much for attending. It's always so wonderful to be able to collaborate like we are tonight with the Rolf Foundation. You're seeing Gayathri and I in our live natural environments. I'm actually inside the demo kitchen at Cancer Wellness Center, and we hope to provide you with an informative program tonight. We have a lot to cover in a short period of time, so I'm going to go ahead and share the PowerPoint presentation that we put together, and thank you so much again. Okay, so without further ado, here we go. On the agenda this evening, Gayathri is going to begin, and she's going to give an overview of pancreatic cancer. Then I'm going to talk a little bit about the questions that were submitted ahead of time. And what you're going to notice is that many of the questions are related to diet and nutrition. So I'm going to wrap the presentation this evening with what the experts recommend about diet and nutrition as it relates to pancreatic cancer. But I can't help myself. As a dietitian, along the way, I'm going to provide some simple steps to improve nutrition and the quality of nutrition in your diet. And then we'll have some time for additional questions and answers. So without further ado, I'm going to let Gayathri take over, and I'm going to advance the slides for her.
Thank you, Lori. And thanks to the Rolf Foundation as well as the Cancer Wellness Center for this opportunity to speak to you all and share, what I know about pancreatic cancer. Thank you also to Aaron and Sabina for the, the introduction and putting this together. So just a little bit about pancreatic cancer, and let me start by sort of going through where the pancreas is in the body and sort of which organs are next to the pancreas. So on the image on the left there, you can see that the big brown structure there is the liver, and under the liver is a gallbladder. And next to the gallbladder in gray is sort of the small intestine. And next to that small intestine is this fish-like structure, which is the pancreas. And it's actually tucked in the body behind the stomach. And the reason why this anatomy is important is because it's nice to know where it is in order to appreciate why it is that patients with pancreatic cancer experience some of the symptoms that they do. But essentially, the role of the pancreas is twofold. One is basically the pancreas does make hormones, insulin and glucagon, and those are important in regulating the amount of sugar in the blood. And it helps body use and store energy. And so removing the pancreas does increase the risk for diabetes and associated issues. The other role for the pancreas is that it provides these enzymes called pancreatic enzymes that help digest food. And so removing the pancreas can lead to issues with digestion. So Lori, if you could hit next, please, thank you. So there are different types of pancreatic cancer, but the two main types are what we call neuroendocrine cancer, which is cancer that forms in the endocrine cells of the pancreas. This is actually quite rare. About 5% of patients with pancreatic cancer have this type, but it is associated with a better prognosis, and it tends to be diagnosed at a younger age. The other more common type that is present in more than 90 or 95% of patients diagnosed with pancreatic cancer is what we call pancreatic ductal adenocarcinoma. And this is cancer that forms in the exocrine cells, basically the cells, again, that secrete the pancreatic enzymes into the pancreatic duct. There are other rare types of pancreatic cancer, and those have been listed there, but really, I'm really not an expert on these types either, so I would refer you to other material if you are interested in these rarer types of pancreatic cancer. If we could advance the slides, please, Lori. Thank you. So there are multiple risk factors that we think we know about right now for pancreatic cancer. I've categorized them as non-modifiable. So these are risk factors that we're just born with, that we can't really change about ourselves. One is family history. So some of us have family history of certain diseases, and one of those is a risk for cancer. Specifically, some families have family members, first degree, second degree family members with pancreatic cancer. Specifically, some patients have inherited genetic syndromes. And I'll go through that in a little bit. Other non-modifiable risk factors are age. So the risk for cancer in general increases with advancing age. So the older one is, the more likely one is to have cancer. That's just the inherent nature of cells in the human body. As they divide, there is a greater risk for them accumulating these mutations that predispose to cancer. In pancreatic cancer specifically, there is some evidence that men tend to be at a greater risk compared to females, and African Americans tend to be at a greater risk compared to, say, Caucasians. Next, if you could hit enter, thank you. So in terms of inherited genetic syndromes, there are different syndromes associated with pancreatic NET, which is neuroendocrine tumor, and there are syndromes that are associated with pancreatic adenocarcinoma. So for the NET, it's neurofibromatosis type 1, which is due to alterations in the NF1 gene, or multiple endocrine neoplasia type 1, which is MEN1, and the other one is von Hippel-Lindau syndrome. These are rare genetic conditions, but patients having these conditions are predisposed to pancreatic NET. The more common type of pancreatic cancer, adenocarcinoma, is associated with hereditary breast and ovarian cancer, which cancer syndrome, which is associated with mutations, alterations in the BRCA1 and BRCA2 genes, or hereditary breast cancer, which is the PELB2 gene. And I've listed the other types of syndromes that are associated with pancreatic cancer as well down there. Includes Lynch syndrome, Peutz-Jeghers syndrome, familial pancreatitis, which runs in some families because of a mutation in the PRSS1 gene, or what I've left out of here is the Lee-Fermani syndrome, which is a mutation in the P53 gene. If we could advance, please, Lori. So the modifiable factors, these are the factors that we can change. Type 2 diabetes is included in this category, and I find it difficult to think of type 2 diabetes as a modifiable risk factor, but if you think about what puts one at risk for type 2 diabetes, hypertension, being overweight, poor diet, heavy alcohol use, those things can predispose one to type 2 diabetes. So that's included as a modifiable risk factor. The other modifiable risk factors are tobacco use, being overweight, heavy alcohol use, and just an inflammatory environment in the pancreas, which leads to a condition, chronic pancreatitis. We could advance, please. So I wanted to sort of show this diagram, which I thought was a very good diagram that sort of goes into the three, how we would manage, or how physicians tend to manage pancreatic cancer. So pancreatic cancer can present at different stages. It can be earlier stage, which lends to it being resectable or removable with surgery, or it could be a little larger, potentially involving major vascular structures in the area, which then makes it borderline or locally advanced, or it could be unresectable. So, putting someone through surgery is not an option, or, the cancer is actually spread to other areas in the body. Most often the liver is the one that's affected. Other areas too can be affected, but that makes it unresectable and metastatic. So, when a physician, speaks with a patient about options, they usually consider performance status of the patient. So how well the patient is, are they active? Are they, not so active? Are they dependent on others for care? So that's what we call the ECOG status. And so depending on the ECOG status, one might be a candidate for surgery or may not be a candidate for surgery. And all that also, as you can see from this image, it also depends on whether the cancer is resectable or not. And ultimately, I think regardless of the therapy that's chosen or the type of management strategy that is chosen, symptom management is a huge part of management of pancreatic cancer. we could advance, please. Thank you, Lori. So with the management of it also comes, besides surgery, chemotherapy, which are the ones that folks tend to hear about more often. There is also radiation therapy that can be used with chemotherapy. When we use radiation therapy or chemotherapy before surgery, we call it neoadjuvant. And radiation can be used with chemo for borderline resectable, basically a larger tumor. And we're hoping to use radiation with chemo to shrink it in order to improve chances of getting the tumor out during surgery. Or radiation can be used with chemo after surgery, and this is done to reduce the risk for the cancer coming back, kind of like insurance, or to prevent the tumor from spreading to other areas. Radiation therapy can also be used alone to relieve pain. There are other treatments less commonly known, I guess, less popular and more novel, if you will. This includes targeted therapy. So, when you have a tumor cell that decides that it wants to spread, there might be changes in genes, and so proteins that might be, there might be genes and proteins that are changed, which lead to the way, which lead to changes in the way that tumor might behave. So if we look at those genes under the microscope, and try and figure out what those are, perhaps we can use a drug, a specific drug for that patient. This is considered systemic therapy, but it's more specific. So the side effects tend to be a little bit more limited. The other option is immunotherapy. Pembrolizumab is one that's commonly used, and this basically enhances the immune system, and in so doing helps to deal with the cancer. I won't go too much into embolization that's used for smaller tumors. Clinical trials allow patients to have access to newer treatments. Next slide, please, Lori. Thank you. So I guess we have some questions.
Yeah, thank you so much, Gayathri. So what I'm going to do now is just list the questions that were submitted ahead of time. So here we go. The general guidelines to follow for post-chemo for diet. What kind of supplemental stuff is okay and what is not? What about eating sugar? What diet is best for pancreatic cancer? What food should I avoid? And last but not least, can diet help with the symptoms of pancreatic cancer? Now, I believe in the power of food and nutrition, but I would be remiss if I didn't integrate a collaborative effort with the medical team as it relates to the symptoms or side effects of pancreatic cancer. So we're going to start with that question first, and I'm going to pass it over to Gayathri, who is just going to briefly overview some of the associated symptoms.
Thank you. So there is really no screening test for pancreatic cancer, and unfortunately, patients who do present with pancreatic cancer do so because they have certain symptoms that they may not have picked up on in earlier stages, or they may have just not had. The common symptoms that tend to occur with pancreatic cancer, I think, are the unintentional weight loss that occurs. So patients tend to lose weight. Patients may have nausea, they may have pain or bloating in the belly after eating. So after eating, they may lose their appetite. Pain tends to be common. It usually is described as pain kind of in the upper abdominal area that may or may not radiate to the back. Jaundice, which is a yellowing of the skin and eyes, can occur. And there might be changes in the color of the urine and the stool. So the reason I'm putting the slide up is because, there are multiple symptoms associated with pancreatic cancer. So any of these symptoms should be a red flag, especially if these symptoms persist, despite, maybe taking a Tums or trying to deal with heartburn and, it's not getting any better. And especially if you're losing weight, certainly should be brought to medical attention. But also, the type of symptom one experiences depends on where the cancer is in the pancreas. So the pancreas really can be split up, if you will, into three different sections: the head, the body, and the tail. And the head is sort of close to the liver. And so if there's a tumor in the head, it could sort of affect the liver, cause a sort of an obstruction in the bile duct, and result in jaundice or changes in urine and stool color. If the there's a tumor in the head, it could also lead to nausea and unintentional weight loss. Nausea mainly because the bilirubin, which is a waste product of bile, sort of accumulates in the bloodstream, and that can cause some nausea. And if you're nauseated and if you have pain, you tend not to eat and you end up losing weight. The body, the mass in a body, pancreatic body, can lead to, just where it is centrally, can lead to pain in the abdomen and back pain. And in the tail, if you have a tumor there, it can lead to pain in the lower abdomen, kind of on the left side, lower belly, can lead to appetite loss, pain, and weight loss as well. Next slide, please.
Okay, so here's where I'm going to contribute a little bit of information as well. So in the clinic where I am, one of the most common nutrition impact symptoms that I experience, besides what Gayathri just presented, is diarrhea. And this can be on presentation with patients. So this can certainly impact someone's nutrition status. If it occurs for a long period of time, someone can become dehydrated or malnourished. Ultimately, the solution to correcting diarrhea is to determine its cause, because there's more than one cause. And so that's where the collaboration between the dietitian and the medical team comes in handy. But in general, what we advise is that patients that are suffering with diarrhea eat 6 to 8 small meals per day. That's just easier for the gut to handle. We also encourage plenty of fluids and the right type of fluids depending on the individual. We're going to assess for hydration status. And then as a dietitian, I like to recommend what foods to consume rather than what foods to avoid. I find that so much more helpful. So we're going to find some alternatives, and lactose is often a trigger food for diarrhea. So we're going to find some alternatives that are just as nourishing. And then we're going to try to include some sources of soluble fiber. So soluble fiber is this special type of fiber that helps to slow the gut down, and it also adds bulk to a loose stool. And where do we find soluble fiber? Well, it's in oats, applesauce, bananas, peeled potatoes, and rice. And I have a lot of creative ways to use these in foods. And then as a dietitian, I would approach the medical team to rule out exocrine pancreatic insufficiency, because the only remedy for that is actually a medical intervention and the use of pancreatic enzymes, which are a prescription. So next, I'm going to pass it back over to Gayathri, who's going to talk about some of the other side effects.
Thank you, Lori. So, coping with cancer in general, especially something like pancreatic cancer, it can be very difficult from multiple angles. One clearly is the physical part of it. Pancreatic cancer patients tend to have a lot of pain that can be difficult to manage, and sometimes with chemotherapy can seem to get a little worse before it gets better, if it gets better. With the pain comes the appetite loss because of inflammation in the area where the cancer is, or as I stated earlier, because of the obstruction in the bile duct, if that's present, or liver issues and bilirubin, if that goes up, that can lead to nausea and an appetite loss. And the other part of it is if one is going through chemotherapy to deal with cancer, that as you probably know is associated with nausea, vomiting, diarrhea, and other side effects, physical side effects of treatment. And it's, I wouldn't be able to list all of that here. There are a lot of side effects that one might experience, but, coping with physical side effects is done in a collaborative approach with a medical team. So the oncologist, the nurse, letting the nurse know when you go in for treatment, letting the physician know when you go in for treatment. And in my case, as a nurse practitioner, I do work with the physician and the nurses to try and figure out exactly what's going on. Oftentimes, I do refer a patient to palliative care, which is a service that can go alongside cancer treatment. And what the palliative care service does, sometimes I feel better than what I can do, is that they have this big toolkit that they can rely on. They have all these different ways to manage pain and mood and anxiety. Appetite issues, they have a whole bunch of things that they can use. So I work very closely with the palliative care team as well. So that's the physical part of it. Along with the physical part of it, and sometimes more than the physical part of it, is the emotional, social burden that having cancer has. We have families, friends, and when someone in the family has something like as grave as a pancreatic cancer diagnosis, that can cause a lot of sadness, anxiety, anger, stress, so on and so forth. a lot of fear, especially with not knowing what treatment is going to bring and what the future is going to bring. So coping with that requires a lot of work. A supportive family, ideally, friends that you can rely on. Hopefully work is understanding, let's one take time off as needed to deal with side effects. There is short-term disability, FMLA, and those things as well. Cancer treatment is very expensive. So we have financial counselors, we have our social workers who can put patients in touch with resources that they might be able to use in order to deal with cancer treatment and sort of the logistics around treatment. Caregivers can actually support in multiple ways, as you may know, besides being with the person that's affected, providing encouragement, talking with healthcare teams. So besides, and now with COVID, it's a little bit more difficult to do that because we just sometimes cannot be in the medical visit with the patient, but certainly getting on the phone and seeing if, the oncologist will be able to, say, call you on FaceTime or put you on speaker while going through during the course of the visit. I think that's very helpful. Coordinating with appointments, transportation, how driving someone to and from their treatments, helping even with medications, filling up a pill box, for instance, or helping with, things that need to be done in the home. And just, being open to support. So both patients need to be open to support. And I think having a supportive environment is helpful for that. But caregivers too sometimes need respite because this can be full-time work for caregivers and sometimes difficult to cope with. So these are just, a tip of the iceberg, as they say.
Thank you, Gayathri. So along the lines of caregiver support, I would say that here at Cancer Wellness Center and also in clinic, sometimes I work more often with caregivers than I do with patients. So certainly they are vital to the team in order to help really conserve energy for patients so that they don't have to spend time grocery shopping or cooking or meal prep. So I work with patients to help find opportunities to keep nourishing foods around. So whether it be the pantry or the fridge or the freezer, we come up with grocery lists. We talk about meal prep as well as cooking because this again conserves energy so the patients don't have to worry about it. Now, I just want to point out along the lines of each of these steps, we want to apply some encouragement, okay? Because sometimes when patients feel pressured by loved ones, they might feel ashamed or guilty if they don't eat enough. And so we find that encouragement really is the best strategy to help patients eat better. So we listed a ton of questions about diet and nutrition, and I have only 15 minutes to get through them. So I'm going to do my best, really, and I thought this graphic here is a good way to summarize a lot of the answers to those questions. So this is put forth by the World Cancer Research Fund. And what you'll see is that following the diagnosis of a cancer, survivors are suggested to follow as many of these healthy behaviors as possible. So you see a ton of them on the slide, but I'm only going to talk to a handful of them tonight that I think are the most relevant for you, especially as it relates to pancreatic cancer. So the first recommendation is to be at a healthy weight. And that's because we find that the weight that we carry in our belly, we call this abdominal fat, or if you have an apple shape, this fat, it behaves badly. It sort of generates an overactive stress response and in turn raises our blood sugar levels, raises blood pressure. It can release metabolic substances that travel throughout our body. And these end up accumulating even in our pancreas. So it impairs the pancreatic function to regulate insulin as well as blood sugar levels. And all of this sort of sets the stage for an environment that is conducive to carcinogenesis. So the recommendations are that we utilize BMI, which is body mass index, as a measure of healthy weight, or to use waist circumference, because this can help us determine if we have that belly fat that we should be concerned about. The recommended cutoffs are for females to have less than 35 inches and for males to have less than 40 inches for their waist circumference. If you are someone who is concerned about your weight and would like to lose weight, I would advise not to follow a fad diet, okay? We want to pursue healthy lifestyle habits. They also happen to be cancer protective at the same time. Or you, of course, could consult with a dietitian like me. Much of my work here at Cancer Wellness Center is related to weight management. The next recommendation is my favorite one. It is to eat a diet rich in whole grains, vegetables, fruit, and beans. And I affectionately refer to this diet as a plant-based diet. And that's because when we eat plant foods, we are consuming cancer's worst food enemies. Okay, let me say that again. Plant foods, cancer's worst enemies. They're just packed with nutrition. So whole grains, vegetables, fruit, beans, lentils, nuts, seeds. They have a lot of special compounds that exert their influence along the carcinogenic process. So we want to saturate our bodies with these foods. And if I were to kind of put this recommendation on a plate, this is what it would look like. So if you see there, half of the plate has vibrantly colored vegetables like broccoli and carrots. And then we take the remaining half of that plate and we divide it in half again. So a quarter of the entire plate is for our healthy carbohydrates like brown rice on the slide. And then the remaining quarter of the plate can be for our quality proteins. So something like salmon that you see on the slide, but certainly if you want to choose a plant-based protein, beans, lentils, and tofu are a great option as well. The next recommendation is to limit consumption of fast foods and other highly processed foods and fried foods. And that's because they are high in saturated fats. So saturated fats, what happens is if we eat a lot of them for a long period of time, it enlarges the pancreas. And it also causes what we call hyperplasia. And that means that the pancreatic cells are constantly reproducing at a faster rate than normal. And so what that does is it makes them vulnerable to carcinogens, and it can lead to uncontrolled growth of abnormal cells. What we have also seen in the data is that eating a lot of saturated fats causes us to secrete more bile acids, and bile acids in turn stimulate the expression of COX-2. And we find that COX-2 is highly expressed along pancreatic cancer cell lines. Saturated fats also have been linked with insulin resistance, and that eventually leads to abnormal metabolic, immune, and hormone function. So again, here we are setting this stage for an environment in the body that may be conducive to carcinogenesis. So here are some simple, let me go back, sorry. I want to just point out a little bit more about processed food because a lot of people have questions about what is processed foods. So if I were to put them in a picture, this is what we would use, okay? So it's edible technically, right? But it's not really food. It's really far removed from being food, and it contains a lot of extras from calories from the wrong things like sugars and saturated fats. And also part of the problem is if we're eating a lot of these highly processed foods, then we're not getting nutrition, right? So it's a low amount of nutrients in these highly processed foods. So the picture on the left shows you those cancer food worst enemies. Again, we want to saturate our body with those choices more often than not. Now, here are some steps to eat less saturated fat in your diet. And this dietitian here has some recipes. So we will be sharing them with you all after tonight. Next recommendation is to limit consumption of red and processed meat. And I'm going to talk a little bit more about that. But let's first test your knowledge. So let's see how you do here. Which of these choices has the least amount of saturated fat? What one would you guess? Well, here you go. Would you ever guess it would be the mayonnaise? On that list, mayonnaise has the least amount of saturated fat. So let's talk about that red meat and processed meat. So the experts want us to eat less than 12 to 18 ounces of cooked red meat per week. And that's because too much red meat can lead to oxidative stress and potentially damage our DNA. Too much red meat can cause inflammation, and it also forms N-nitroso compounds, which happen to be carcinogens. We make them when we eat a lot of red meat in our diet. We make them in our gut. And also, if we were to cook red meat at a very high temperature, so we're talking about almost like burning the meat on a grill, this in turn creates carcinogens, and they're called heterocyclic amines and polyaromatic hydrocarbons. Those are carcinogens. Now, a little bit more about processed meat. So we have a cutoff. We're allowed to have maybe 12 ounces of cooked red meat per week, but the experts want us to minimize processed meat as much as possible. So we define processed meat as being meat that is preserved by smoking, curing, or salting, or the addition of chemical preservatives. So classic examples of processed meat are bacon, hot dogs, deli meat, things like sausage or chorizo, and they contain those N-nitrosyl compounds, those carcinogens. And eventually they are going to reach our pancreas. So here are some simple steps to consider if you're looking to reduce red meat or processed meat in your diet. Again, I have recipes for each of these. The black bean burger happens to be one of my favorites, so you have to look for it. The next recommendation is to limit consumption of sugar-sweetened drinks. Let's first test your knowledge before I talk more about that. So of these choices, which would you guess has the least amount of added sugars? I'm going to give you a little bit more time on this one. What would you guess? Which one has the least amount of added sugars? You might be surprised. So the chocolate milk, like what a treat that would be, right? The least amount of added sugars of those choices listed. It's pretty astounding to see how many teaspoons of added sugar in some of our foods. So here are some simple steps to eat and drink less sugar in the diet. The problem with sugar is that it really, when we eat too much or drink too much of sugar, it leads to weight gain. The experts are convinced that it is a risk factor for being overweight and becoming obese. And this in turn will raise our blood sugar levels and raise insulin levels. And we know that this has an implication in pancreatic cancer. Also, too many sugary beverages creates oxidative stress. So that's a stressor to the islet cells of the pancreas. So we really want to take some steps to reduce them in our diet if we can. The next recommendation is to limit alcohol consumption. And the experts want us to really not drink alcohol at all if we can help it. And that's for several reasons. They're not really sure what the problem is with alcohol and cancer risk, and specifically pancreatic cancer risk, but we do know that alcohol itself metabolizes into acetaldehyde, and that's a carcinogen. It also alters metabolic pathways that are involved with inflammation, part of the carcinogenic process. It increases oxidative damage to our pancreatic cells. And then lastly, it impairs the regulation of proliferation and apoptosis. And really what that means is it just interrupts the normal cell cycle of a healthy cell. It interrupts that. So it's out of whack, essentially. And alcohol is partly to blame for that. So as a dietitian, I would encourage you to drink less. And, there's a lot of ways you can pursue that decision. It's up to you, and working one-on-one with a dietitian can help you understand what is the best step to take first. So I would say pick and choose from this list. Maybe you want to just have alcohol one day a week. If you're looking to have less, you get to decide. And just for your reference, on the slide here is what you will find is a standard serving size for an alcoholic beverage. And the last recommendation I'm going to present tonight, do not use supplements for cancer prevention. The experts advise that we meet our nutrition goals through food first. And that's because food is superior to any supplement we could ever possibly take. I have another quiz question for you. So in a report, how many cases of liver damage out of 700 reported cases were linked to a dietary supplement? What would you guess? How many times were supplements to blame for liver damage? You might be surprised by this. 130 out of those 700 cases of liver damage when there was a need to go to the emergency room because of it. So I mentioned that because this is why we don't necessarily recommend haphazardly taking dietary supplements. We currently have no evidence that dietary supplements prevent or cure cancer. And there are definitely concerns about safety, as I just presented. We find that dietary supplements may cause an interaction with prescription or with treatment or even over-the-counter products. They may contain contaminants like heavy metals, and they may also be contraindicated with some conditions. So I would say this isn't a request, but a recommendation. I know a lot of patients I work with take dietary supplements, and the medical team just wants to know about them. So let us inform you and guide you appropriately to see if they're safe and worth your time, worth your cost, or if it's something that we should stop. I've included some links on the slide here for some really helpful tools for you to explore on your own. And I just want to summarize with this slide. So I think this is another great demonstration of how to plan meals that really are the most nourishing. And this is called the New American Plate. And it's very similar to that other plate that I demonstrated. There's a lot of plant foods. There's a lot of color on this plate. And again, they will saturate our body with the most cancer protective compounds we could possibly eat. And there's room for protein, even if it's from animals, but it's going to be a smaller percentage or smaller proportion of the plate. And this is put forward by the American Institute for Cancer Research. The link is on the slide, so you'll get to see that also. You know, I think as much as I can, no matter where anyone is on the cancer continuum, I encourage ways to try to eat meals this way. Sometimes side effects and symptoms may prohibit this, but we're going to find other ways to make this work for that individual. So this here is our reference slide for your information. And with that said, we have just enough time for additional questions that might have come through.
Wow, thank you. That was a great amount of information and really helpful information. We have a lot of questions that are coming through, so I will get started with them. So sticking on the vitamin front, can you clarify what you mean by dietary supplements? Do you include, is that all vitamins in general, or is it specific?
All vitamins. So you know, the actual definition of dietary supplements has escaped me at the moment, but it's really anything isolated synthetically and then put into our body. So it's herbals, botanicals, vitamin D. At this point in time, we do not see an indication for the majority of our cancer population. There are instances when there are exceptions. And so it's best to have that conversation with your medical provider.
For sure. So one question we have is somebody who is continuing to lose weight and also has a distaste of food after a Whipple procedure that recently took place. Is this typical, and what can they do to help with that?
I'll start, and then if you want to add, Gayathri, yes. You know, when I have someone in clinic that is planning for a Whipple, they're on my radar. This individual, whoever submitted the question, please reach out to your team, see if there is some help that you can have, and whether or not it's a referral to an oncology dietitian. As Savina shared at the beginning of the program, I meet with individuals here. So I'd be happy to try to help because this certainly is an issue and common, and there are solutions, but they really depend upon the individual, and I need to do a comprehensive assessment in order to do that.
The only other thing I would add to that is I think typically the weight issues, they tend to be worse the first 4 to 6 weeks, and then they seem to improve. And is that because we're coping with it a little bit better? You know, we are learning more about ourselves and what goes and what doesn't. Maybe a little bit of that, but I think there's also healing that's going on, and that healing has gone on more 6 weeks. So I think there's sort of light at the end of the tunnel, so to speak. Yeah.
That's a great point.
It's great to hear. What would you say, Gayathri, are the most important aspects of managing pain, you know, in recovery and beyond?
I think, first of all, being aware of it, letting your healthcare provider, your nurse know that you're in pain, and keeping a log, if you can, of when it is that you experience the pain. Is it after food? Is it throughout the day? What intensity of pain you're having? What you've tried over the counter? Have you tried something like ibuprofen or Tylenol? Is it not quite cutting it? Have you used any adjuvant, methods like a heat pack, for instance, things like that? And that actually gives the medical team a lot of information that they need in order to sort of fine tune what they think might work for your pain. Of course, there are different types of pain medications out there. There are the non-opioids and other over-the-counter stuff that I've already mentioned. There are also opioids, narcotics, also known as, and these sometimes can be important. But we don't just start medications like that, quickly. We tend to assess pain, and we want to go slow on these medications because it takes the body some time to get used to them. So
Sure.
what I would say, I guess, bottom line is let the medical team know what you've tried, how you're feeling, and let them give you the suggestions, and we'll go from there. And I think it's a continuous conversation. It's not something that's going to always work out the first time, but just being aware. And the other important piece of it, I think, is staying ahead of the pain. I think the mistake that's made very often is patients take pain medications when the pain is really bad, and that really you're not giving the pain medication a chance to work. If you anticipate pain, take the medication before the pain gets bad, say when it's mild or moderate, and especially if it's predictable, take it before it gets bad. And that way you're staying ahead of it,
For sure.
Let me just add one more thing if I could. The body is one interconnected piece. So if one is not getting, rest at night, is tired, that tends to make pain seem a little bit worse. And if you're rested and your mood is better, that tends to make pain a little bit better. So that's where support from family, getting your rest and your nutrition, the right amount of fluid, the right nutrition in, I think is really important.
Sure. What about acupuncture as an alternative way of relieving pain or managing pain?
You want to take a stab?
Well, I don't know of any evidence that I can speak to. I think that, a lot of complementary modalities are, as long as they're safe, are worth exploring. I know at Kellogg Cancer Center, we do have an acupuncturist that meets with, patients, and, it's a lot of times it's free, a free service, which is incredible, so I think it's worth exploring, but I can't specifically comment to any sort of science or evidence in terms of recommendations.
Okay.
Yeah, I second that. I don't think there's any strong evidence out there for the use of acupuncture. In fact, the last time I looked, there wasn't a strong evidence base for that, but it is relatively safe, non-invasive, and worth a try. It has worked for some patients. I've had patients come to me and say acupuncture has really worked for my neuropathy, for my pain, in some cases for anxiety. So I think it's worth a try if that's an option, if that's something that's available to you.
Okay, great. So there's a lot of questions that have come in about abdominal discomfort, bloating, and excess gas. What's the recommendation there from a food perspective? What they should be eating, what they shouldn't be eating, and then any medication or opportunities within that as well?
Yeah. Oh gosh. I love this integration, right? I love the suggestion that Gayathri mentioned during the last question about pain, that keeping a journal is everything, right? Because especially as it relates to digestion, I think we're so unique. And so I think that every single individual I work with finds they tolerate certain foods or have problematic foods, or their schedule of eating or the quantity of food. Like there's so many variables, and that's where working with a dietitian can really dig deep into those variables to determine like what makes the most sense for that individual. And a lot of times journaling, the patients I work with, they find the answers before we even get to meet again. So it's really incredible. So we also look at eating behaviors, right? So if you're sucking in a lot of air somehow, that can certainly lead to gas and bloating as well.
Yeah, so simple measures like I would say, chewing your food well, eating slowly, not chewing gum. If you can do that, chewing gum introduces a lot of air into the system. Eating fast does the same thing. Medications like Gas X can be very beneficial. There's Beano. These are medications, especially the Gas X. It's given to pregnant women, so it's very safe. And it doesn't really get absorbed into the system, and all it does is work in the GI system, and it works really well. So those are medications that tend to be effective.
Great.
In some cases, I should say.
So another question came in that symptoms of pancreatic cancer sound so common. Are there a combo of symptoms that people should be most aware of in terms of red flags? Is it the jaundice and the weight loss piece, or what does that look like so that people can have a better understanding of when to reach out?
Yeah, I think the weight loss piece, I'm sorry, I just jumped in there, but I think the weight loss piece, especially if it's unintended weight loss, someone hasn't been trying to lose weight and, it's just noticed that they're losing weight. Jaundice would be a symptom that one would go to their doctor for. I think in itself, just jaundice by itself needs to be assessed. What about, say, nausea? If someone has nausea and that's managed by, things like acid reflux in some patients could cause nausea, right? And it doesn't mean that just because someone has acid reflux and nausea that they're going to have something like pancreatic cancer, obviously. But, taking something like Tums and Pepcid and seeing if that acid reflux improves and so the nausea improves, obviously that's comforting. So my thing is, if you have a symptom that's persistent, say for a few weeks, despite your best efforts at trying to, improve it, just go see your primary care physician about it. They will know what questions to ask you and sort of, what to be worried about or concerned about. I try, even for my own health and my family's health, I don't leave anything to guesswork. If there's something that I'm not sure of, I just go and I seek help. It's hard to know, there isn't a test, one test to know if one has pancreatic cancer. Usually there's a lot of imaging that needs to be done. And even before the imaging, as a provider, in order for me to order imaging, I would have to know the patient's symptoms. And so I'd have to perform a good history. And that would require me speaking with the patient, getting a good history from the patient. So
Sure.
I hope that answers the question.
Better to be safe and go
Better
in.
to be safe.
Right. If someone doesn't want to eat or is having trouble post chemo keeping weight on, what do you recommend?
I love this question. Yeah. And this is very often what pancreatic cancer patients struggle with. So I'm almost automatically triggered to meet with those individuals in the clinic. So hopefully this individual has access, again, to a dietitian. If not, remember, I'm here and I would be happy to help. But generally speaking, what I suggest is bang for buck, as I put it. So we talk about how in a small quantity, you can get high quality for calories. So we actually turn towards the healthy fats like olive oil or avocado or nut butters, as long as the patient can tolerate them okay, because it doesn't take a lot and they go a long way. So for example, something like peanut butter, a tablespoon is 100 calories. Oils added to food like olive oil, a teaspoon is almost 50 calories. So it really helps to close the gap for someone who is unable to meet their nutrition goals, but also too, it's my job to help in collaboration with the medical team. What is the reason for that person's poor appetite? Is there something else underlying that state? Is it nausea? Is it constipation? And so we troubleshoot as well, but also look to kind of for opportunities to close that gap with bang for buck options.
Great. Is there a recommended amount of water intake for those going through treatment?
What a good question that is.
And everybody else?
Not really. I mean, I think it depends on the individual, and there's so many variables that come into play that would influence someone's hydration status or recommendations for hydration. So it's hard. So I would say, actually, don't believe what you read when you hear like 8 glasses of water a day, like it's really individual. So I would double check with your healthcare provider.
Okay.
Yeah, I mean, when I get asked that question, I say generally, if you don't have a condition like congestive heart failure, you don't have any limits or restrictions on water intake that have been provided by a physician, I say 50% of your body weight in pounds. So say if I weighed 150 pounds, I should be maybe drinking about 70 to 80 ounces of fluid, give and take, right? And that is not just water, but it also includes the soups you might drink during the day, the juices, um, what else? Popsicles that you might indulge in, the ice cream or the shakes that you might indulge in. So it includes all of that. And I think, listening to your body, if you are getting thirsty, that is like the body's way of telling you, get in some fluid, right? So you got to listen to the body.
Is there such thing as too much water?
There is such a thing as too much water. So we have seen patients in the clinic that really go all out and drink a ton of fluid, just plain water without electrolytes. And every now and then we see the sodium levels drop, and that can lead to other issues like confusion and fatigue and things like that. So there is such a thing as too much water, but we don't see it very often. And I think that tends to occur more with just plain water. If you're doing soups and you're mixing it up a little bit, your body's going to generally cope with it pretty well.
Okay. Let's go to sugar. Sugar is bad, obviously. How about sugar alternatives? Monk sweetener, stevia, all of the ones that are out there. Is that still sugar? Is sugar sugar?
So yeah, what a great question. I think we can do a whole presentation about that. Gosh, so the experts say that in the doses that we consume, that they are safe. Now, it depends on the individual. I think if you want to minimize exposure to anything, sure, I'm an advocate of that. And I also think that artificial sweeteners sort of trick our taste buds, right? So we sort of become immune to how sweet sugar is, And so I'm an advocate for minimizing as much as possible artificial sweeteners. And sometimes that takes time to do. But just keep in mind, I think I presented that graphic for a reason. Like there are so many important things to consider, that if you're having artificial sweeteners, it probably didn't cause cancer. It's not making the cancer worse. But it probably, if it's on your list of things to do, I would keep it there on a list of something to minimize.
Okay. I want to acknowledge that we're going a little bit over, and I hope everybody's okay with it. The questions that are coming in are amazing, as are the answers. So thank you. We just wanted to name that and keep going. Let's talk about going back to water. Carbonated water, is that contributing to the bloating, to the stomach pains?
Probably. Yeah, probably. So sometimes if people like the taste of them, we recommend they flatten it out a little bit. But yeah, that'll contribute to bloating and gas. Yeah.
And how about alkaline water? Does that help? We have someone who said that some people have recommended this for pancreatic cancer.
What a great question. I get that one actually quite often. It's a nice thought in theory, but the thought is that cancer cells thrive in an acidic environment and create acids as they metabolize. So could we override all of that by making our body alkaline? Well, unfortunately, we can't because our body has compensatory mechanisms that will kick in so that our pH levels are within the ranges they need to be. Which differ according to which part of our body we're talking about. So the pH in our stomach is very acidic for good reason, but the pH in our bloodstream, different. It's higher, and it actually needs to be in a very tight window in order for us to be healthy. So if that ever gets thrown off, the body uses actually our kidneys to change the pH level to respectively, to manage that. And Gayathri can probably speak to that better than I can.
Yeah. But the only other thought I guess I have is, if the acidic environment, because acid in the stomach can in some patients cause the nausea, especially if they're not eating. So would drinking alkaline water maybe neutralize that a little bit? That's just one thought that I have. Not that I've read anything about it, but. that's just the local environment.
That's a
Food
great
for thought.
That's a great thought. Yeah.
Going back to supplements. So someone said, I keep hearing the average human should add magnesium supplements to daily routines. Should this be avoided and instead eat foods to have this? If so, can you give some examples of what good foods would be for magnesium? Even, vitamin D, we hear, especially in Chicago winters, we need vitamin D. So what are some alternatives, some food alternatives that we can get in our system instead of going for those supplements?
What a great question that is. So again, that's when a dietitian can be the most helpful, because I can give a comprehensive evaluation and assess what someone is eating day to day, and what they will eat or won't eat. So maybe you don't like almonds, which happen to be high in magnesium, or can't tolerate them, right? So maybe we need to find another source like spinach, and then how do we actually incorporate these foods into your meal plan? Magnesium supplements, I just want to share, can cause diarrhea. So we want to be careful about that. And again, just discuss use with your medical team and providers. But yes, ideally, I think food forms, the ones that I mentioned, are the top on the list. Consider those. But again, I think working with a dietitian can best address that. For vitamin D, we for both magnesium, which is a mineral, and vitamin D, we do find that Americans don't eat enough of either of those. Vitamin D is not really amply supplied in our diet. There's a little bit in salmon and eggs, but it's really not a high amount. Otherwise, it's fortified to foods like dairy, for example. So sometimes patients will ask for their vitamin D level to be assessed in blood work. And I like that, because then that gives us an idea of what someone's vitamin D status is without them just haphazardly taking a vitamin D supplement. So often that's what we advise.
Okay. Yeah, I mean, so true about the vitamin D, especially. Vitamin D, we are finding that it's important for a whole bunch of things in the body, from mood to infection, to immunity, to health in general. So, most of us are deficient in vitamin D, and, every single week I see at least 2 or 3, that might be deficient, and we end up starting a vitamin supplement. So I absolutely encourage, checking in with your physician if you're concerned about a vitamin D deficiency. So at least we know, and if you're really low, we can start a high dose supplement for 8 weeks or so to get you up to speed. And then you can go back on the daily 1,000 or 2,000. But yeah, there is hardly any vitamin D in our diet, and we don't get much sun here in Chicagoland. So most of us do need the vitamin D. Yeah.
As noted by the snow that was falling earlier today. So let's talk, let's go into dairy. Is dairy okay? Is plant-based better? Or again, does it depend on the individual?
Yeah, wow, great questions. I wish I had all the time in the world. So I'm going to try to be as concise as I can. So, is dairy absolutely necessary in a healthy diet? No. And how do we evaluate a healthy diet? By a single food or by a single nutrient? No, we want to look at the overall package, right? All of the food someone's eating or not eating, and then we can best evaluate what is a healthy diet. So if someone likes dairy, we'll talk about, okay, what makes sense for that individual? How do we help make it fit in terms of the number of servings a day in a healthy diet? If someone does not care for it or is just looking to reduce animal foods in their diet, then yes, we want to seek out alternatives that are sort of comparable in terms of their nutrition, right? So a lot of the alternatives tend to have a high amount of added sugars. I probably should have put that as a quiz question. So, we're getting these added sugars by making that substitution when I don't know if it's a better substitution. So that's where I can be very helpful. We look at alternatives like soy milk or pea protein milk because they have beneficial compounds in them and give a good amount of protein, which a lot of the individuals I work with in clinic require a little bit more protein in their diet. So that's an important consideration to make.
Sure. And you talked about not following fad diets. So would gluten-free be part of a fad diet? Would going all organic, is that considered fad or is that healthy? Is that appropriate?
Yeah, what really great questions. Sometimes a gluten-free diet might be necessary. It's the only therapy if you're diagnosed with celiac disease. If you are not, and you suspect a gluten intolerance, then again, that might require just working with a dietitian to see what foods that contain gluten or what amount of gluten are you potentially sensitive to. But I think that first needs to be ruled out that you don't have celiac disease. Otherwise, if you go on a gluten-free diet, you're missing a lot of really great stuff. Like gluten is not a bad thing. There's a lot of great whole grains that have fiber that help regulate our blood sugar, right, and our insulin levels. And they also supply a whopping amount of B vitamins, iron, and zinc. So we don't want to necessarily exclude them.
Sure.
As it relates to organic food, I'll disclose that, I'm an advocate. I think if you can go as organic as you can, sure, it's not going to hurt you. I think there are some concerns about finances. So, there's ways to save. But certainly I think if it's something that's important to you, yes. But again, a dietitian can evaluate that, right? So if you're not eating the recommended servings of fruits or vegetables, I don't care if it's organic or not. I just want you to eat the fruits and vegetables first, right? And then we can go to the next step. So that's where you can see this all become so specific to the person I'm working with.
Sure. And on the meat front, is it red meats or is it turkey, chicken? I mean, are those, or fish, are those okay to have, or is that part of the
meat question? Yeah, that recommendation about meat. It's red meat, really. And it has to do with the saturated fat that's in red meat, as well as the heme iron. So that's iron that's found in animal foods like red meat. It's like this perfect storm, so what happens is when we eat a lot of that, so we're talking, the cutoff is 12 to 18 ounces a week, which I think, in my opinion, that affords us a good amount of red meat safely, as it stands right now from what the experts say. So, I think we just want to try to, again, work with the individual to see how much they're having right now and then work their way back. But of course, fish and poultry and eggs, these are valuable proteins that are lower in saturated fats and can fit in part of that healthy diet.
Well, great. Well, thank you. We could be talking about this for the next week. This is so interesting and so helpful. Any closing remarks from either of you? No is an okay answer. I'll put you on the spot.
Yeah,
Go ahead, Lori.
Yeah, I just wanted to share, like my alphabet soup after my name. I'm a certified specialist in oncology nutrition. Like you heard how amazing Gayathri's background is, like genius, right? So I'm so happy to co-present with her. But, we're here tonight because we really care about what we do. And, we'd be happy to help. We're hopeful that you've learned a little bit of something from us tonight. And we're happy to share the resources with you after this evening. So thank you.
And then the only other thing I would say is, Lori has been wonderful to work with, and I work with her and I send her messages, and even today I sent her a couple of messages on patients that I've seen and hoping to get her input on them. So, it is a collaborative effort, and, anyone who has to go through this difficult process, I just want to say, use your resources. Your providers are probably going to work as a team in order to help you out. It's difficult to sort of deal with these things individually. So even when it comes to caregiving or coping with all of the things that go with a pancreatic cancer diagnosis, it doesn't need to be done alone. So work together and hopefully we can help.
That's perfect. And it's so important for everyone to know that you're not alone in all of this. And that's what Ralph Pancreatic Cancer Foundation and Cancer Wellness Center is all about. And we're so grateful, Lori and Gayathri, to both of you for joining us today and sharing your knowledge. It was really fantastic. And we want to thank everyone who has been watching and asking these amazing questions. It's really you that we're here for. And if you're watching on the replay, you can still ask questions. You can put in the comments, you could put replay and then put your questions, and we'll get those to Lori and to Gayathri and make sure that we get those answers to you. If you have any ideas on topics or speakers for additional Wellness Wednesday episodes, please send us an email or send us a message on social. You could send an email to info@rolffoundation.org, and keep your eyes posted for our May Wellness Wednesday announcement that's going to be coming soon. On behalf of Ralph Pancreatic Cancer Foundation, Cancer Wellness Center, thank you both, all of you, so much for joining us tonight. And until next time, please stay healthy, stay safe, and take good care. Good night.
Good night, everyone.
Good night.